If you're in Canada waiting to see a specialist, here's the number you can't ignore. 22% said their health deteriorated while waiting. Waiting isn't just inconvenient, it can be scary. You're trying to manage symptoms, keep up with work, and stay calm, but every day without answers can feel like risk. And the longer it drags on, the more helpless it can feel. The hardest part is often the question no one can answer clearly. How long will this take? When your calendar depends on a referral pipeline, you end up planning your life around unknowns. So let's look at the real numbers behind that experience. In Canada, in 2024, 36% of people waited 3 months or longer for a first specialist consultation. That means long waits aren't an exception. They're a common experience, and time becomes the hidden cost of access. And it doesn't stop at 3 months. 11.4% waited 6 months to less than 1 year for that first specialist visit. When you're waiting that long, symptoms and stress can compound, physically and emotionally. This isn't just being impatient. 64% said specialist waiting time affected their lives. And among them, 66% reported worry, anxiety, or stress. That's a real mental burden on top of a medical problem. A key factor is the pathway. In Canada, 89% saw a specialist via referral, and speed differs. 66% of self-referred people saw a specialist within less than 1 month, versus 31% of those referred by a clinician. Access design shapes waiting. Before we talk about next steps, quick clarity. I'm not here to help you buy private care in Canada. I'm showing you a real alternative to compare, including China, where the pathway can feel more predictable. For example, Punch in Beijing has an international medical department for foreign visitors, and you can book through the English interface in their official app. They also state plain MRI reports are typically issued within 2 working days, and foreign patients can register using a passport. That's why China can be worth comparing. If you're feeling stuck, you don't have to decide today. But it can help to understand what the China option could look like for your specific case, prices, realistic timelines, and safer hospital choices, so you can compare calmly. Start on WhatsApp for free guidance. For personalized support, it's £3 per text question or £30 for a 30-minute consultation. This is Nova Medical Bridge with Nova. I help you map your options clearly instead of waiting in uncertainty.